Hi, my name is Hannah, and I am a first year in the Health Policy MPH program. They prioritize community here, and I think that that's really important when pursuing public health. So yeah, Gillings is the #1 public health school in the country, and that is for a reason. We have amazing professors here, amazing research opportunities, so many resources to leverage. And again, I think that they really leverage the community here. There are people here so passionate about public health, and they really prioritize having a community of people and passionate about public health in all the different areas. And I really love that we get to talk with people in different concentrations, professors in different specialties and disciplines, and I think that that's really great. And yeah, I've just found a really supportive, passionate community, public health community here.
My name is Aisha. I'm a first-year MPH student in the health policy concentration. UNC Gillings was the only school I applied to because for me, it was all or nothing. I wanted to be secure that the program that I chose would be a program and a degree that would give me tangible skills as soon as I graduated, something that I would be secure that I would have a job afterwards, and something that I would still have a support network outside of graduating. Our professors here have not only taken us into their classroom settings, one-on-one meetings, but they've also taken us into their home and really fostered that professor-to-student connection that I can't find anywhere outside of the school. Here at UNC Gillings, you're offered a super well-rounded experience. Not only are you allowed to take classes in your concentration, you can take classes in different departments, meet up with professors outside of this field, and even take classes outside of UNC Chapel Hill. When I was touring and they were saying that concentrations ranged from 10 students to 30 students, it made me incredibly nervous that I wouldn't be able to get in. But after applying, my biggest worry, which was the size, became the biggest thing I loved about this program.
Hi, my name is Julia Ruth, and I'm a first-year Master's of Public Health student in the Health Policy concentration at UNC Gillings. I think my favorite part of the program is being in a cohort and being with your peers. We're in a cohort of about 26 students, whereas a lot of the other schools I had kind of looked at and was deciding in between, you were going to be in cohorts of up to 50 to 70 students in your classes and with the class schedules. And I think that individualized support that you're able to get not only with your peers and in your cohort, but also from the professors really stood out to me. Really facilitates a tight-knit, a close community, and I think it's a really cool and unique opportunity to meet people that I probably never would have met if I wasn't here. Although we all kind of share, I would say, a lot of the values around public health and health policy and what kind of drives us in this field, everyone really brings a different and unique perspective. So a lot of the stuff that we're talking about in our courses, which I think has been a really great learning opportunity for me too. And I think that these are relationships not only with my peers, but also the professors and people that support in that program that are gonna last me for years. Another thing that I thought was really cool and unique about health policy and management is the background of the professors. I think that it's really cool. They have a lot of really cool career experiences, like working in a federal agency, working in policy advocacy roles, including a lot of their really cool policy research that they've engaged in as well. And it's how it's guided them to UNC specifically and guided them to health policy and management. I think that it's really unique specifically to Gillings that a lot of them have that career focus. It has a really good balance from what I had kind of observed compared to other schools of having professors that are doing really cool research and engaging in a lot of that and other aspects, but also who've had really long and really strong career experiences too, that they can kind of draw a strong connection between those both.
Hi, my name is Claire. I am a first-year MPH student in health policy here at Gillings. One of the things that I really appreciate about being here is the community. The professors, the staff, your peers, everyone here is extremely supportive. If you're deciding between UNC and another school, the one thing that I would really like to emphasize is the support that the professors and that your peers provide. Professors and faculty really rally behind you in a way that I haven't really seen at schools before. I think a lot of us coming into grad school feel imposter syndrome, especially being at a university like North Carolina and in Gillings, which is the #1 public health school. It's very intimidating, and a lot of times I think we have a lot of self-doubt. Do I belong here? Is this for me? Am I qualified? If you are admitted here, you deserve to be here. You are qualified, you are experienced, you are here for a reason. And this education is really going to supplement your previous experiences or add even new experiences that you didn't even know existed or weren't sure were things that you wanted to explore more or get into. So that was really nice. And the imposter syndrome, it does wear away. I will say that. It goes away. Everyone will start to learn and realize that we all are very different and each of our experiences are unique.
Hi, my name is Mabeki. I am in the Health Policy and Management concentration of the Masters in Public Health program. I think what makes the program really strong is they emphasize collaboration over competition. This school makes it really hard for you to fail. They provide you with so many resources, and they really do want to see you succeed. I think my biggest concern was that I didn't have much work experience. I only had 1 year of like part-time work experience, and it was more like social work. It was like just adjacent to public health. I guess once I got here, I noticed that there were also like some different people there was just a good mix of people who had like a lot of work experience, some people who had like clinical work experience, others maybe more in the public health field, and others who like just came straight from undergrad. And so I guess something that helped like belay those concerns was that the school seemed to really embrace diversity and experience. I think something I'd like people to know is that in the program, it does feel like they encourage you to sort of develop skills to sustain yourself here and make sure that you're able to apply your knowledge as best as you can to like real world situations, but they don't just toss you like into the ocean. They really help you and like really provide you the resources to like, take those steps forward. I think you should go to Chapel because first of all of the faculty are really great. Not only are they well equipped to teach the material, but they also teach it in a way that is really easy to understand and also something that you can take with you after you graduate. It's also a really strong like alumni network and people to reach out to. And just like the area is really cool. I love Chapel Hill. The vibes are great. There's a lot of things to do and the weather's great, so.